Hello and welcome. Today, we're diving into a comprehensive comparison of two significant compounds for blood sugar management, metformin and berberine. Type 2 diabetes affects millions globally, making effective blood sugar control crucial for long-term health and preventing complications. Metformin is widely recognized as the standard first-line medication for type 2 diabetes, while berberine emerges as a natural, plant-based alternative. Our goal today is to provide a detailed comparison, empowering you with information to discuss with your healthcare provider for informed decisions. Metformin, a biguanide, is a prescription drug that has been a cornerstone in type 2 diabetes management for decades, known for its safety and efficacy under medical supervision. Its primary function is to lower blood glucose levels through several key mechanisms within the body. Metformin significantly decreases glucose production in the liver, a process known as gluconeogenesis, and enhances insulin sensitivity in body tissues. It also reduces the absorption of glucose from the intestines, further contributing to lower blood sugar levels. While its exact molecular mechanism is still being fully elucidated, it's understood to involve the activation of AMPK and other crucial metabolic pathways. Berberine, in contrast, is a natural compound, an alkaloid, extracted from various medicinal plants such as European barberry, golden seal, and Oregon grape. Historically, it has been utilized in traditional Chinese medicine for treating conditions like diarrhea and infections. Berberine offers potential benefits beyond blood sugar regulation, including improvements in cholesterol and lipid levels, and even a reduction in blood pressure. Unlike metformin, berberine is readily available as a dietary supplement and does not require a prescription. However, it's important to note that the research supporting berberine is generally less extensive and often involves smaller studies compared to metformin. Both metformin and berberine exert their effects through fascinating metabolic pathways, with some notable similarities. Metformin primarily inhibits mitochondrial respiratory chain complex I, which leads to the activation of AMP-activated protein kinase, or AMPK. AMPK is a crucial regulator of glucose and lipid metabolism, playing a central role in energy balance. This activation reduces hepatic glucose production and increases insulin sensitivity by enhancing peripheral glucose uptake in tissues. Berberine also activates AMPK, mirroring one of metformin's key actions. Additionally, berberine increases glycolysis, enhances insulin secretion, and inhibits hepatic gluconeogenesis and adipogenesis. Both compounds may also positively influence gut microbiota, contributing to their metabolic benefits. Clinical trials have extensively demonstrated metformin's efficacy in lowering HbA1c, fasting blood glucose, and triglyceride levels. Its long-term benefits include a significant reduction in the risk of diabetes-related deaths, solidifying its role as a cornerstone treatment. For berberine, studies indicate comparable HbA1c reduction to metformin in newly diagnosed type 2 diabetes patients. A meta-analysis confirmed that berberine alone significantly improved HbA1c levels compared to placebo, and it also shows promise in reducing triglycerides and total cholesterol. However, it's crucial to remember that metformin has a much larger body of extensive research and long-term safety data. Regarding side effects, metformin commonly causes gastrointestinal issues such as diarrhea, nausea, and abdominal pain, especially when first starting treatment. A serious but rare side effect is lactic acidosis, more likely in individuals with impaired kidney or liver function, necessitating regular blood tests. Long-term metformin use can also lead to vitamin B12 deficiency, requiring monitoring. Berberine's common side effects are generally milder, including digestive issues like diarrhea, constipation, gas, and upset stomach. It is typically considered safe for short-term use, up to 6 months in most studies, but long-term safety data is still accumulating. Berberine may also cause low blood pressure in some individuals, and potential drug interactions exist for both compounds, underscoring the need for medical consultation. Certain individuals should avoid metformin, particularly those with severe kidney or liver disease, or anyone at an increased risk of lactic acidosis. For berberine, pregnant and breastfeeding women should avoid it due to potential harm to the fetus or infant, and it's contraindicated in newborns due to the risk of kernicterus. Individuals with high bilirubin levels should also exercise caution with berberine. Always consult a healthcare provider before starting either metformin or berberine to ensure it's appropriate for your specific health situation. In summary, metformin is a well-established prescription medication with clear guidelines and extensive research supporting its use. Berberine, a natural supplement, shows significant promise in similar metabolic pathways, but requires more comprehensive research. Both can effectively lower blood sugar, but neither should replace medical advice or prescribed medications without professional consultation. Discuss your options with your doctor to determine the best course of action for your individual needs. Thank you for watching. For more health-related content and personalized advice, remember to consult with your healthcare provider.